everybody able to hear me okay? Okay. Those of you sitting on this corner, you may be able to see me at the bed. Otherwise, refer to the screen there. You'll be able to see things pretty clear there. The items in our thing right now includes ChloraPrep. ChloraPrep is what's used at quite a few of the facilities now. Most have upgraded to this. There are a few places that you may be that do not use ChloraPrep, and they will use alcohol and betadine. Keeping in mind, if you do run across any that use alcohol and betadine still, the actual procedure will be a little bit different, and the method in which you scrub the skin to clean it will be a little bit different also. So, what's the first thing you always do before you do a procedure?
Wash your hands.
Wash your hands, and what have you even done before that, so that you know what you're going to do and how you're doing it?
Check orders.
Check your orders, and what else?
Identify patient.
Identify patients good also. How about what's going to be specific for your hospital? How will you know what they want you to do?
Check your policy.
Check your policy. Your policies will tell you if they're using the ChloraPrep, or chlorhexidine is the correct term, or if they're still using alcohol and betadine. So you've got to always check your policy before you proceed with a procedure. Don't just assume that you know how to do it because you were shown in school. The hospital may be a little different. So I know that my patient is due to have a dressing change today. Now, for something like a central line dressing change, it's not too common that you're going to have the doctor actually write it, because this also goes to policy. The frequency with which you change it and what you use to change it depends on policy. So when I first did my assessment this morning on my patient, I assessed him well, I looked at his central line site, and I noticed that it was changed a week ago. Now, knowing my policy, which tells me I need to do these dressing changes every 7 days, I know today's the day that he's due to be changed. So the frequency with which you change these, most often if it's covered by the clear biocclusive film, most facilities it's going to be every 7 days unless the dressing becomes soiled or loose. If it's soiled or loose, you're going to change it then. You're not going to wait until 7 days are up. You've got corners peeling off, you're not just going to try to secure it with more tape. You're going to change that dressing if it's loosening at all. Okay? So I know it's the day for my patient to have his dressing change, and it's going to be a good time now to do his dressing change, so I'm going to go get all my supplies. Now, when you do this dressing change, it is a sterile procedure. Think back to what we just discussed about where this IV ends. It ends in the superior vena cava usually. If I were to have an infected site, or if I were to contaminate something during my procedure, my patient's going to get an infection, catheter-related bloodstream infection, and the fatality rate on those is too high. There is research that shows that every infection that's caused from the catheter-related bloodstream infection adds between $35,000 and $50,000 per hospital stay, plus an additional 7 days in the hospital. People who do get bloodborne infections, 90% of those are caused from central lines. Of those people who have the catheter-related bloodstream infections, there's a 14% fatality associated with those. So that's why sterility during your dressing change is so important. And we will be watching you for sterility issues. If you think you contaminate something, you stop, you get new supplies. If your glove's contaminated, you stop, you put on new gloves. Because otherwise the infection that you may cause could cause your patient's death. Okay? So I'm going to gather the supplies I need. I'm going to need my dressing kit. I've already reviewed the contents and I know what is in it. And I also know that I'm going to need a pair of clean gloves and a bag for disposing. I'm also going to have my bottle of instant hand sanitizer there. However, if your patient has C. diff at all, the alcohol-based gels do not do anything for C. diff. Okay, so I've got my bag for discarding things. Now, if I'm thinking, I'm actually changing this on the opposite side of the bed than what I usually do so that I can project my voice a little better to you. If I dispose of my items down here, I'm going to be crossing over the sterile field all the time. So think very carefully where you want to set your bag so that you will not be crossing your sterile field. Okay. So I have gone ahead and I've washed my hands with soap and water. I'm going to peel back the bedding, and I've talked to my patient. I've identified him. He knows who I am. I've told him it's going to be changing your dressing today. And have you had any trouble before when they've done your dressing change? He says no. Are you allergic to anything? And I want to make sure that he's not allergic to anything that is in my kit. This is a latex-free kit. I want to make sure that my gloves, if he's allergic to latex, my clean gloves are also latex-free. And I'll make sure he's not allergic to the bio-occlusive dressing that will be used or any of the preps, such as the ChloraPrep. It says no problem before. He's had it changed several times. It's doing fine, doesn't cause him any troubles. Good. So at this time, I'm observing the area. I'm going to look closely to see if there's any redness, any discharge that I see coming around the insertion site, and that's looking good. If there are sutures, I'm going to see if the sutures are still in place holding things, or if the sutures are now loose and broken away from his skin. And actually, I have put a Steri-Strip on here to stimulate sutures. So he is sutured in place. Looks good. I'm going to feel the area. Does it feel warm? Does it feel cold? Does it feel mushy or kind of crackly, like Rice Krispies under his skin? Because if that's the case, I may have an infiltration issue. I'm going to compare side to side here when I look at his chest. It's not like a hand that you can easily look at and see swelling. In a chest, in some individuals, you won't really be able to see swelling unless it's gotten very extreme. So you need to compare. Do they look symmetrical? They look fine. When I feel, he has no discomfort, it doesn't hurt, and there's no drainage. Okay, so at this point I'm just going to grab a little corner here of the opposite so that I'll be able to pull that off easier. Once you get your gloves on, it's going to be hard to get that corner. I've made sure my patient is in a comfortable position. Okay, now I do not want to take the dressing off. I am just loosening a corner. Now at this point I may be needing an assistant to help hand me a few of these things. I've opened up my kit. I have it setting on a good spot. If I could bring my table over, I'd put it on there. Or here so that you can see my contents. I've left it on the bed. Okay. Now there are sterile gloves in this kit. I'm not using the sterile gloves yet, but I'm going to take the sterile gloves out so that I can get at my mask. They're still in their sterile package. They're good. We need a mask on. The mask is for me. I've also brought extra masks so that I can give one to my assistant, and I'll also give a mask to my patient. But if my patient is unable to tolerate a mask, if his respirations are compromised, I'm going to have him turn his head away from the insertion site. So with it being on this side, he's going to turn his head towards me. Now before I take that dressing off, I'm going to put on my mask at this point. So just so that you can still hear me, I will not put the mask on, but I pretend I've got the mask on at this point. Everybody else is also masked up right now. I will apply my clean gloves, And I am not turning my back on my sterile supplies that I've got set there right now. I'm going to secure with one finger. Make sure you get clean gloves that actually fit you. These are too big. The dressing ends right here. I am holding down the catheter with one finger so that I do not dislodge that catheter as I pull off the dressing. Now I do not want to touch the skin underneath that dressing. And as I pull it off also, I want to go towards the insertion site. Look at the path which the catheter was inserted at. That's the direction that I pull the dressing towards. Because if I were to come down this way, it is feasible that I could actually pull that catheter out. So I go towards. And I do not want the dressing that I'm taking off to go back on this area underneath, which would be considered a sterile area. Now, as you notice, the dressing kind of tore a little bit on me as I took it off. I've never had that happen in real life. Okay? If you've got one that is sticking very, very hard, you can actually take alcohol and work alcohol along there as you are loosening your dressing. That will help remove it. And if you pull on their skin a little bit, that will also help. A mannequin doesn't have skin that's movable. So at this point, I am not going to touch anything underneath where that dressing was. I do not want to have my hands with my clean gloves touch that catheter that was covered by the dressing. I don't want my hands to touch that insertion site. But I'm still assessing my insertion site, looking for anything else that I maybe did not see while the dressing was in place, and also notice if there's any unusual odor. If there's an odor, there might be an infection present. So at this point, you're not going to want to put a dressing on until you have your nursing supervisor or the physician check that too. So I'll remove my gloves, dispose of them. Now, I do not want to leave the bedside to get my hands clean, so that's where this comes in handy. Generally, they say about 3 to 5 milliliters of your alcohol-based solution is what's appropriate to use. Okay. I've talked to my patient. He says he's doing fine. The mask isn't bothering him at all. He feels good. So I'm going to put on my sterile gloves. Now remember, the gloves that did come in that package are sterile. So make sure you put them on, maintaining sterility. Okay. Which hand do you usually put on first? Dominant. Okay. And please hold your hands high enough off of the table so that you're not going to contaminate it on the sheet. Okay. The part of the cuff that actually tore me is way far down. Let me get on my other glove and we'll see how these look. If I'll be able to use them or if I should get a new pair. Okay. And all this time I have not turned my back on my patient. I see him out of the corner of my eye. He knows not to be touching anything or talking over anything. Okay. And actually, I don't know if you can see, I don't like where that's ending. I want a new pair of gloves. Okay? So this is where I should have brought another pair of gloves in the office with me. So I'll have my assistant grab me a size 7. No, they'll be in there. If you see 7s, otherwise there's a box in there that has extras. Okay. If it had been way down here on my wrist where it had torn, it would be okay, but I was way up here by my palm. That's not good. And I've got 2 pairs, you never know. be using for cleansing his skin actually has been shown to be persistent on the skin for 2 days, and its effectiveness lasts for up to 5 days. You guys are not the only ones who get your fingers in the wrong spots. Okay, so gloves are on at this point. Everything's looking good. I'm going to go ahead and grab my chlorhexidine. Now, in your kit, you will also find an alcohol swab stick. If you find that your patient has a lot of drainage on their skin, you will use the alcohol swab stick first to remove any unusual exudate that's there. Okay? He has no drainage. It looks really good. So I'm going to discard of that. And I'm just going to drop it there. The chlorhexidine has wings on the end. So you're going to hold it down, squeeze those wings, and you could maybe hear it snap a little bit. You're breaking the ampule inside that has the chlorhexidine. You're going to squeeze it several times to moisten the pad, and you can visibly see it is wet. I'm not sure if the camera's picking that up. It is moist. At this point, keeping everything sterile, briskly back and forth, and it is a 30-second scrub. Okay. Now my hand that I had just placed on the catheter to also stabilize the catheter is now no longer sterile. Okay, and I'm doing that because I don't want the sutures to come loose. So a 30-second scrub, back and forth, and you will scrub vigorously, applying friction. Because as you scrub, you're also helping to penetrate that chlorhexidine down into the skin. You can keep your hands far enough up on the handle so that you will not touch his skin. And you are scrubbing approximately a 4-inch or 3-inch by 4-inch or 4-inch by 5-inch, depending on the size of your dressing area. Okay? So see what your policy says. The majority are usually a 30-second scrub, but it varies anywhere from a 15 to a 2-minute scrub, depending on policy that you're looking at. 30 seconds is kind of the standard. So at that point, I'm going to go ahead and discard that. And I'm going to need now my Opsite, which I can actually grab myself out of the package. Okay. Now I do have my one hand, which I did touch, that is no longer sterile. So I don't want to touch any of the sterile part with my non-sterile hand. This hand is sterile, so I can touch any part of this. Okay. The Opsite that is prepared in your package has a back panel that is going to come off first. And I believe you've dealt with some like this before. Okay. So you'll peel off that back panel. I am not touching the part that has to stay sterile. I'm peeling off the entire thing. You'll notice it has a nice firm window around there so that it stays flexible, or not flexible, stays rigid. Okay. I don't want to do this. I don't want to cross my dirty hand over the sterile field. So I'm coming from below. I'm holding a corner that does not go on his skin. And I allowed that to dry for anywhere between 30 seconds to 2 minutes, depending on what policy says. And you can definitely see where the skin appears dry. It will no longer be shiny. Okay? So I'm going to seal that down good. And on a real person, it dries quite rapidly. Okay, after that is down, I'm going to remove this outer window pane. And it's no longer sterile right now because the area that is covered is the area that needs to stay sterile. And we'll make sure all the edges are secured. At this point, he can remove his mask. I can remove mine. I'll remove my gloves right now. And you'll notice there are a few leftover supplies within the kit. There's some 2x2 gauze and also a split 2x2 gauze. See what your policy says. There are a few occasions when this is a very new insertion that you will be using the gauze just because it's going to help to absorb any blood that may be coming. But usually after they've had their catheter in for at least a week, you're not going to use this at all. If you were to use it before you put the transparent gauze on, the split gauze would go around the catheter and this would be placed on top of the catheter, and then your transparent dressing would go on top of that. However, you don't use that very often. Also, what you have in here is a protective wipe. If you have a person whose skin is very fragile, maybe it's an individual that it's harder to get the Tegaderm, there's all sorts of different terms, that transparent dressing to stick. After you have used the ChloraPrep and allowed the ChloraPrep to fully dry, you can then open up this. It will look a lot like an alcohol swab. It smells a little bit different though. It smells a little sweeter. You can open that up, swab the area over which the dressing is going after the ChloraPrep is dried, and this will also act as a further barrier to protect his skin from the adhesive of the dressing. You also have some tape in there. How I'm going to use the tape is I'm going to just move how this catheter was laying so that his skin gets a little bit of a break there. And I'm just going to put a small piece there. It's just a security tape so that it doesn't accidentally get caught. You'll do that on somebody whose catheter is not actually being used at the moment. If it's being used, you usually will not do that. And this is something else you can do, but you won't always have to. If you're having problems sealing at the bottom, I'll tear off a small part. And I've just made a little slit in that to work around my catheter. And then I can tape the bottom edges of the dressing. And it's okay if you do not routinely do that. It's not very often that I've had to do that. Last thing I'm going to have to do now is date and time my dressing. So I'm going to put down the date that it was changed, my initials, and that way when the next nurse comes on duty, she knows when it has to be changed again. I found this on that outer border of your transparent dressing. There's a little label on that. When you tear it off, you can write on that. Otherwise, once again, you've got your tape, and you can write on that. Never tear the tape off, put it on your patient, and write on their chest. They don't like it. So make sure that you write on something else and not on your patient. I'm going to put this on the dressing off to the side so it's readily seen. Dispose of my items, get him covered back up, get him comfortable, and then I will go. And do you feel that these items would need to be disposed of in biohazard? When do we use biohazard? If there's obvious blood or body fluids. His dressing was clean, there is no drainage, I will not need to use biohazard. If there was a lot of drainage, usually if it's something that you can wring out, you need biohazard bag. If that were the case, I would have to put this in a red biohazard bag. And of course, gloves to discard it. So I'm going to document in my nurse's notes. It's possible that there may be another area, say on the medication sheet or somewhere in the Cardex, that you may have to document that the dressing was changed, what the site looked like, and if there was any complications that you ran into. So are there any questions at this point?
30
30 seconds is the standard, but depending on where you are, their policy may be different, but 30 seconds is the standard. How long will it need to be dried? Once again, usually 30 seconds is the standard, but it may vary. If 30 seconds has gone by and their skin's still looking wet, well, you don't put the dressing on. Wait for it to air dry. Will you ever dry off the area? No. Let it air dry. How can you assess for infiltration in a PICC line? And you know this is something that we didn't discuss. So I showed you what the PICC line looks like. Now you've got a person who's got a line in one arm but not in the other. So think like what you did with the chest. Is one way you can do this? Compare. Even better than comparison, though, is actually measurements. So the nurse who will insert the PICC line will sometimes take measurements, approximately 10 centimeters above the insertion site, and document that. You may find your patient will even have lines on her arm so you know where you're supposed to put the tape measure around. So if you measure in the same area, you'll see if it's getting bigger that there is an infiltration that's occurred. Another thing you should do with a PICC line, if it's within the policy, from the insertion site to the hub, you will actually measure length. That's how you'll know whether or not it is migrating out or migrating in. Okay, if the length is changing, and if it is, that is definitely something you need to bring to your supervisor's attention. Now, if a securement device is used, how often should this be changed? Now, the securement device is something you would most often see on a PICC line. Sutures are sutured in. A securement device is what I had mentioned where you might see like a hard plastic thing with sticky tape on it, holds it in place. You should change that securement device with each dressing change. So if they do have one that is not sutured, you would be changing that securement device at the same time. Are there any questions? Okay. Yes?
When you're doing that 30-second scrub, it looked like, was there a chance that the PICC line would run off?
It was moving on him, wasn't it? Yes. Part of it is because the way that I set it up on the mannequin, I had it way low. Sutures normally are very close to where it's actually inserted, so I've not run into that being an issue because usually those sutures are very close, so that I didn't actually dislodge it when I removed the outside. I put it way lower than what you will ever find. So otherwise on a PICC line, because I don't always find them sutured in, it will sometimes move a little bit, so you just have to be very careful as you're doing your scrub, because that would be a potential. Is there anything else? How many pairs of gloves will you bring with you to the room? Bring your extra. So